Malaria kills more than 600,000 people a year, 95% of them in Africa. But now the world's biggest vaccine maker will start rolling out a cheap new malaria vaccine in Africa starting in May. That's in hopes of boosting the fight against one of the most deadly infectious diseases in the world. We're going to talk more about this now with our regional correspondent, Eunice Masson in Cape Town. Eunice, which countries have been hardest hit by malaria across Africa?
Yeah, so quite a lot of countries, but there's been 5 countries accounted for just over half of all malaria deaths worldwide. That's according to the World Health Organization. And those countries include Nigeria, Uganda, Mozambique, and the DR Congo. And just last week, we saw health ministers of 12 African countries come together in Cameroon to discuss malaria. And those countries included, but it's not limited to only Burkina Faso, the DR Congo, Ghana, Mali, Sudan, and Mozambique. And earlier this year, Cameroon launched the world's first routine vaccine program against malaria, stressing the burden of malaria in that country. Now, in terms of where this specific vaccine that we call the R21 would be rolled out, it will mostly be distributed through the UNICEF, the UN Organization for Children, and the Global Vaccine Alliance that we call Gavi. And the first 5 countries who will receive the vaccines are Chad, Central African Republic, the DR Congo, Mozambique, and South Sudan. Now, according to UNICEF, Uganda and Nigeria are planning to introduce the vaccine later this year.
Eunice, what more can you tell us about the rollout of the vaccine that's going to start happening in May? Who will benefit the most from this vaccine?
Definitely, and the answer is short, but children will benefit the most from this vaccine rollout. Now, the next vaccine rollout that hopes to start in May, June, will be given to children between the ages of 5 to 36 months old. In 2022, the death rate due to malaria was 608,000 worldwide, of which 77% were children under the age of 5 years, stressing the importance to get vaccines to them. So the majority of malaria deaths are among children, and previous vaccine pilot programs actually showed that now this was a different vaccine that was used, but in 3 African countries it showed a 13% drop in children deaths, according to UNICEF. So the hope is to increase that drop and prevent deaths due to malaria, especially among children.